Welcome everybody, and thank you for attending this Lunch and Learn session organised in collaboration between the Knowledge and Library Services at NCIC and CLIC, the Cumbria Learning and Improvement Collaborative. My name is Ashley Eaton and I am from CLIC, and today we are joined by Jose Hodgkins, who is a carer and member of the North Cumbria Cancer Care Collaborative, and she will be sharing with us what the collaborative is doing to improve the patient experience of cancer care. So these Lunch and Learns are designed to be a relaxed and informal space for health and social care staff to come together and share their experiences. So now, before we kick off, just some quick protocols. Webcams, it says they're on at the start, but if you could turn your webcams off shortly, that would be great. If you could mute, please, when you're not speaking as well. Post any questions in the chat, and we will also have some time for questions at the end as well. Please listen with respect and be present. Pass on as well and share the learning, spread the word about these sessions, and please be aware that we are recording this session. We will also be posting a link to give feedback in the chat. So if you could please complete that, that would be much appreciated. It's very short, just a couple of questions. I will now hand over to Jose.
Hello everyone, it's lovely to meet you all, and thank you for inviting me to the session. A little bit about myself. I recently retired as a head teacher at Easter, having had 25 years in education, and before that my husband was in the Air Force, so I followed the flag as an RAF wife for many years before that. My husband was diagnosed with stage 4 prostate cancer at the start of the year, which came as a huge shock to both of us because he didn't have particular symptoms that would think that he had cancer. So it has been quite a challenging time for both of us during this time. The diagnosis process was not easy, with delays and poor communication. And I feel it's really important that patients have clear communication throughout their cancer journey. And so I joined the Cancer Collaborative. I must admit, I was terrified to start off with, although probably most of the group would have said she was not terrified at all. She never shut up. And my thoughts are that if one person has a better experience than my husband had, then I know things have improved. But I would say working with the collaborative is I know there's a passion within the trust to improve care. And working with the collaborative, it's also given me a huge insight into the complexities of the NHS. Things are never as easy to fix as you think they are. So, and I am quite passionate and I am quite vocal, but it's about improving the experience from a patient's point of view. I know the trust working hard from their point of view, but having that patient point of view is really important. So next slide, please. I've just been Matt Hancock today. So the group's made up of patients and carers, NHS staff. We've got voluntary services, the Macmillan nurses, and there's wider professionals who come into the group as and when we need them to come into. So what I would say from our point of view as a patient and carer's point of view, how supportive the trust is in giving us a voice and helping us overcome the barriers that we see there. It's really good in the fact that the group also links with Northern Cancer Voices. So I go to the Northern Cancer Voices meeting and the Northern Cumbria locality group, which I have found absolutely amazing to see what is going on in the wider services of cancer care. And again, it just shows the complexities of the system within the NHS. So next slide, please. So what were the aims of the group? And I think when I joined the group, I wasn't quite clear of the aims. I just wanted to voice my concerns about the experience that we had had. I didn't realise that it could lead on to so many amazing things during the last 9 months. So there's a real focus in improving that patient and experience and outcomes through accessing the cancer services. The support and the wider support for cancer services, and looking beyond the medical aspect of treating cancer and the wider aspects and the impact it has on people. The huge thing for us is to improve communication for patients throughout their cancer journey. And that is really the key focus of the group, about communication. Throughout our experience, it's when the communication's really poor that you're already in a stress state having a cancer diagnosis, and then you just get a very poor communication, and it sends your stress levels much higher. And that's not only for the patient, it's for the carer looking after that patient. I think there are times when I've been far more anxious than my husband, and there's times when he's been far more anxious than me, and sort of working together to try and make it easier for both of us throughout of it. And so the other thing is to empower patients to be involved in the process. And the big point we have is it's a process that's not been done to them. It's your cancer journey. Everybody should work together and make it as the best experience as possible. So next slide, please. So how does the collaboration work? I must admit, monthly meetings, I thought, oh, I'm going to have to travel, I'm going to have to do this. No, it operates on Teams, and we meet on the first Thursday of each month at 3 o'clock, and it works really well. So that's the meeting with the patients, the carers, and all the trust staff as well that are supportive in this process. Outside of that, the patients, carers, and we're really well supported by Jane McFarlane, who is Living With and Beyond Cancer. And she is amazing, and she facilitates the monthly working group meetings where the patients and carers can develop the ideas to present to the monthly meetings, and they take away and they do what called the meaty stuff of the work outside of the monthly meetings. And that's that we do that in person and on Teams. So some people don't want to join us physically, so they join on Teams, and some of us meet together. And it's a lovely group, and we're really keen to find more people to join the collaboration, so we get wider viewpoints and people with different skill sets, so that the work we are doing improves just in the quality of the work we're doing, but also improves the quality of care that patients receive from the trust. So the group patients and carers identify the problems, and the trust members on the group are very keen that the ideas come from patients and carers. What is their experience, and what do they feel from a patient point of view would improve cancer care? And I would say that the support we get from the professionals within the group is really, really outstanding. They really listen. They take the point of view. They will say to us, well, that can't happen because this and this, and that is about the patient group understanding those wider complexities of running the national health. I think I was quite naive in some ways of thinking this will be quite easy to change, and then you sort of see how different aspects of the services all have to link up, and you can fix something in one area, but actually it would cause a problem in another area. So that support from the professionals is really vital to the group. So the collaborative members, as I've already said, support with other groups that are identifying areas for improvement. So I was recently on a meeting with the Tyneside Collaborative, looking at the work that they were doing and sharing the work that we were doing. So actually the collaborative groups across the north of the country are not replicating work, but it's interesting that every different trust has a slightly different way of running things, which is another thing that I find quite complex when it's a national health service, and really it should be a national trust service. So, and we're always on the lookout for patients and carers to join us. So, you know, anybody that's listening today, if you can pass this information out to patients you have, or family and friends who have cancer, who have had cancer, who are caring somebody for cancer, who just feel passionately about cancer care in Cumbria. So next slide, please. So actually, what have we done? So it's not a talking shop at all. You know, it is an action group. So communication was the big thing that everybody on the group identified as needing to improve patient experience during the cancer journey. And it was having clear and concise and timely communication, and also that there's a voice and a clarity for patients about their treatment plans. Sometimes I have felt that it's just like, oh, right, so actually you need this and this will start tomorrow, and and you don't have time to draw breath. So it's sort of working through that communication. And also I struggle sometimes with letters from the trust that just say you have an appointment on this date for an outpatient, and you're like, why have I got this? Well, why has he got this? Although I do all the correspondence. Why has he got this? What's it for? Is it a follow-up? You know, and it would be, you know, one of the things later on we will look at as a group will be the letters, that it would be really helpful to say, this is a first appointments meeting, this is a review clinic for your results, just on that letter, that so you've got a clarity of what you're going for. I mean, we've turned up to an appointment and not known why we've gone. We've had a letter, it says turn up at outpatients, we've gone. Doctor said, do you know why you're here? And we said no, and he said, I don't know either. So it's things like that that actually make cancer journey more complex. So what we did initially was we sat down as a group and we looked at all the key touch points of communication you would have, the key touch points of when you've got appointments going in. So, you know, your first appointment with the GP, your first consultant, your scans, your biopsies, your results clinic, your treatment, your oncology, and all of those. And we looked at them and then started looking at the corresponding communication, but from a patient's point of view, not from the clinician's point of view, and how that made us, the patients, feel. Did it add to their anxiety? Did it make things easier? So we looked at that, and actually the touch point plan that we have is really the skeleton of the work that we are focusing on to improve communication from a patient's point of view. Next slide, please. So what have we done so far? Because as you can imagine, the touch point plan is quite big. So we actually thought we would start at the beginning. So look at the 2-week wait referral. Really interesting. So some of the members of the collaborative part of support groups or go to a cancer cafe, and so sort of spoke to patients and people at those meetings to ask what their experience of the 2-week wait referral process was like. And the key points that came back was several people came back with people didn't realise that it was a cancer pathway. that they just thought it was like, oh, NHS being really quick and off the mark, and they didn't realise it was to rule in or rule out cancer. And it's really funny because now we're in our cancer land, as I call it, our parallel universe of cancer. Everything I see on the TV with cancer in, sort of, my brain takes in much more than before my husband had cancer. I would, sort of not be aware and not take it in. So that lack of clarity that it is a cancer pathway. Looking at how information was given. So lots of the people we spoke to didn't have any written sheet that said you're on a 2-week referral pathway and this is what it is and this will what happen. Most of it was given verbally. And the key thing that has come out from speaking to lots of patients with cancer is actually, my husband always says, I get into a medical situation and my brain turns to mush. I have no idea what they have told me because the only word I hear is cancer and the rest goes out of the window. But he had no idea when he went and he was told that he was getting a 2-week referral that the appointment was to look at cancer. So when the doctor said this is serious, he was like, well, I know it's serious because I'm at the hospital, and didn't realise that the tests that he was having were to look at how, if the cancer had spread or anything. He just thought they were precautionary. So we looked at there was a leaflet and looked at the leaflet information, and then as a group we shortened it to make it was two sides of an A5 card, shortened it down to just one side of an A5 card, but very clear that this is to rule in or rule out cancer. So then we've sent out a survey to GPs, and at the moment we're still trying to get GPs to respond to see how they use the 2-week referral process. So any of you that are in GP practices, please look out for a link to a survey about the 2-week referral process. Maybe as patients we're coming at this from the wrong angle, but this is the angle that we see would help patients that we've spoken to. And then, we are aware that the faster diagnosis standard will impact the 2-week referral process, and we will look at that in the future. So that was the first thing we've looked at. So that's something that's still working on in the background to get that looked at. So the next thing we looked at, next slide please, Ashley, is the Macmillan nurses on the West Coast, who are absolutely amazing. It is an outstanding service, and the support we've had from the Macmillan nurses, I can't sort of give them enough credit. But way back in February, we got a letter from the Macmillan Nurse Service, and we read it and said, oh, somebody will be in touch with us in a week. Nobody was in touch with us in a week. So I read the letter again and I was like, well, it does say a week. And then at the collaboration, brought this up and somebody else said, oh, well, that's how I read it. So we took the letters that were looked at and with the support of Kerry Hawke, looked at the service that was there and did some work on the patient letters that you receive, because actually they are in touch within a week if a referral is made, but it wasn't explicit or as explicit as a patient needed on the letter. The other thing is we found that especially with a stage 4 diagnosis, actually you have enough to cope with without having to think, well, I need to phone somebody to get an appointment. So actually one of the things that we worked with is for the cancer care reviews that an appointment is made, and then actually you would cancel it if you didn't want to go to it, but it wasn't a case of you had to go and make that appointment. An amazing piece of work with such support from the professionals within the collaboration. When I spoke to the Tyneside group, they were like, so what were the barriers of you doing this? And I was like, there was no barriers whatsoever. You know, we were supported all the way, and these letters are now being used on the West Coast. My next passion is that the Macmillan community nurses are spread right across the north of Cumbria, because they do an amazing job. So next one, please. So actions from the touch points. The next thing we looked at was, I remember at that first appointment, we walked out knowing that he was having some scans, but neither of us knew. Well, I sort of remembered an MRI scan, and he said, oh, well, there's another one. And so we struggled to remember, because of that worry and anxiety in the setting, and we didn't ask any questions. We weren't expecting cancer. We didn't ask any cancer questions. We just didn't ask. So one of the things we're looking into is a future investigation sheet given out at the end of an appointment, which would say your further investigations are these and the timeline for them. So we didn't know a timeline that he would have them. He was really efficient. He had his MRI and bone scan within 2 weeks. Great. It was a full month before we got any results, but we didn't know that actually we could have chased them up, but we didn't have a phone number. So this would give details of a phone number to phone, empowering patients to check when they might receive their results. So at the moment, this is waiting to be looked at for a pilot in one of the departments on the West Coast for 3 months. So it's not quite there yet, but it's not far off. So we're hoping for that. Next slide. And then the next thing we looked at was, I remember once he was diagnosed, we came home with a mighty pack of loads of information, which was amazing in loads of ways, but totally overwhelming. And in that pack were some really important things that actually we needed at that point. And some of the things in the pack, you know, you might not want to have a look at for a couple of months. So what we're looking at is pulling together a pack that's got the essential items on the front of that pack. So it's things like, in the middle of this pack was the free prescriptions information. But to be honest, by the time we walked out the meeting, I didn't want to look at anything. I didn't want to read anything. I felt sick opening the pack. But actually, the information for support groups and living with and beyond cancer, all the Macmillan information, was really vital to moving us on in this process. So that work is currently being undertaken, and actually the collaboration has created a letter to go on the front of it from the collaboration, and then patient cancer specific packs would then be given out as normal. But what we thought was the key information was right at the front, that you got it so you knew what you were doing. Next slide, please. And then in future, what are we going to do? So we're currently looking with the Cancer Centre, who are absolutely amazing, and Suzanne, I know she's on the meeting. Thank you for the meetings we've had to look at patient information for radiotherapy. Just had sight of an amazing video for patients going for radiotherapy at Carlisle Cancer Centre, which is taken at Carlisle Cancer Centre. Will just be amazing for patients going for radiotherapy and reduce their anxiety. Talked about letters. You can hear I'm passionate about the letters, and information for the end of treatment. So it is vast, the work that you're doing. So next slide, please. How can you help us? This is the collaborative. And as I've said, if you can pass our information on to patients, carers, family, friends, anybody that would like to join us, they might not want to come to the monthly, more formal meeting, but they might want to come to the working group meeting, which is more informal. And you know, it's giving people a voice to change experience from a patient's point of view. on top of all the amazing work that the Trust is doing, trying to improve cancer care within the Trust. So, and further information, Jane McFarlane, who's Living With and Beyond Cancer, and the collaboration has now got its own email address, which is North Cumbria at northerncancervoices.uk. Or you can contact myself on my personal email number. But if you go through the North Cumbria at Northern Cancer Voices, that's actually an email address that's picked up by several of us. So it's not just one person that would be answering. So I rushed through at the end because I looked at the time and went, gosh, where has that time gone? But what I would say is this experience from my point of view has been amazing. You know, the work that professionals do in cancer care is absolutely amazing. But I would just like people to sometimes think what it's like from a patient's point of view. And it's a very scary place at times for some people. So, but thank you. And thank you for listening to me.
Thank you so much, Josie. We really do appreciate that. That was fantastic. Has anybody got any questions for Josie? Please feel free to pop them in the chat or come off of mute. I think we had one in the chat while you were speaking, Josie, from Jane Smith. She's asked if someone on the group is experienced with neurodiversity to think through how someone with dementia might understand, you know, a cancer diagnosis.
So any of the work that we do is actually sent back into the Trust media department. So although we have our say in it, it's then sent back to the Trust media department and they would look. But I think we've looked at it from a point of view of reading age of patients. So no, there isn't, but we do rely on the media department of the Trust.
Something for us to think about, isn't it, Josie, going forward?
Going forward. So that will be picked up at the next meeting. So thank you for highlighting that. That's a really good point.
Any other questions for Josie? I know some of you have asked for a copy of the PowerPoint presentation. So if you could just pop your email, Amy's just put it in there. You pop your email addresses in the chat and then we can send those slides out to you. That's not a problem. Suzanne's popped in. Great to hear about the work of the group and how it has evolved. It will really make a difference to many people. Thank you.
Thank you. But thank you for all the professionals that work with us, because, you know, we couldn't actually do it without that professional support. And thank you for everybody that works with cancer patients, because the service is, you know, the face-to-face contact that you have with professionals during your cancer journey is amazing. You know, the radiotherapy department staff were absolutely amazing with my husband, so thank you.
Brilliant. Well, thank you ever so much, Josie. I can't see any other questions in the chat. So thank you, everybody, for attending. If you could complete the survey, the evaluation, that would be fantastic. And we'll pop the link back in the chat again for you shortly. And once again, thank you so much, Josie. Really appreciate you coming on here and sharing the work that the collaborative are doing.
Yeah, this isn't my job. I am just a volunteer.
Exactly. No, thank you so much, Josie. We really do appreciate it.
Oh, there's one that says, would Josie give this PowerPoint to the West Cumbria Community Forum? Yes, if you send details.
Yeah, we can find out from Jane. That's I'm sure will be fine. Brilliant, lovely. Thank you ever so much, everybody, for attending. There will be some more lunch and learn dates coming up soon. So keep your eyes peeled. And I hope everybody enjoys the rest of their day. Thank you so much, everybody.